How to increase my semen volume? Hello everyone, I am Dr. Srikanth Munna, consultant urologist and andrologist from V9 hospitals. So, a lot of people who are trying for pregnancy or having some psychological issues come to me asking for how to increase my semen volume. So, first of all, we have to talk about normal semen volume. The average Indian semen volume is roughly around 1.5 to 3 ml. So, if it is more than 3 ml, that is considered as large volume. If it is less than 1 ml at least, it is considered as low volume ejaculate. So, what are the reasons for it? What are the effects of it, that, and how to treat it? So, what is the first indication for your high volume? You should be worried that my semen volume is low. That means I may not have pregnancy, I may not have masculinity, I may not have fertility or potency. These are all rubbish. Okay, so your semen volume is not related to any of these things. But yes, if there is some problem, your semen volume may go down and it may require proper evaluation and treatment for that. But as I said, your sperm volume is very low out of that seminal volume. Semen is a different thing. It's a whole quantity of volume which is ejaculated outside. It is called as semen. It contains multiple components. Of that, the sperms are only 5% of the volume. The sperm is a testicular cell which is produced there and which is related to your pregnancy, which carries your genetic material to your kid. So the sperms are only 5%. But what about the other 95% of the semen? Most of it is from the seminal fluid. Seminal fluid is nothing but supporting fluid or nourishment fluid for the sperm to survive in the vagina. Because the vaginal pH is very acidic, the sperm itself cannot survive there. So this seminal fluid creates an environment for the sperm to travel, to swim, to reach the egg and to cause fertilization. So these are all supporting our nutritional volume which is present for the rest of the 95%. And some fluid comes from the prostatic secretions. Prostatic secretions also nourishes the sperm. Very little amount comes from the urethra, which is your urine pipe, for the lubrication and this sperm to help travel forward. So 95% of your volume, even if it goes down, it will not affect your fertility. Of course, but if the volume is too low, the sperm may not have environment to swim forward and to find the egg in the vagina reaching the uterus. So you may have infertility issues, but it is not solely because of your low sperm count, but it may be because of your low semen volume. So most of the patients coming to me, they think about larger semen volume will give their potential to their highest level and partner satisfaction. There was a study in 2018 which was done in foreign for about 250 patients. Only 13 females thought that larger semen volume is related to better orgasms. The 87% has a realization that their orgasms are not at all related to the semen volume. So even lot of male will be thinking, because of watching pornography, which is artificially created for larger semen volume, will be producing larger orgasms in the partners, or is it is related to some masculinity. But that is not the issue. So now coming to the causes of low semen volume. One could be genetics. It is a normal running in their families, maybe a low volume ejaculate, but good sperm count and good orgasms, good erections, no issues. These patients may not be treated. The second thing is, and the most common cause medically, is the hormonal differences. It is not just the low testosterone, of course, which is already established cause for the low semen volume. There are two other hormones which are important here you need to check. One is serum prolactin and the other is thyroid profile. So serum prolactin, high levels of serum prolactin and low levels of thyroid hormones are also related to low ejaculate volume. So these hormones needs to be corrected for increasing the semen volume. The other medical conditions which may result in low volume ejaculate are diabetes, spinal cord injuries or other neuropathies which may cause retrograde ejaculation. That means the ejaculation coming forward, it may go back into the urinary bladder because of neuropathies, where the patient may only have trickling of semen volume and think that his semen volume or ejaculate is low. But actually the hormone, the volume of the semen may be normal, but it is not expressed out, rather going back. And the last cause which has to be discussed is age. With age, the semen volume definitely decreases. Most of the times, the reason is low testosterone or increased prostate. So the prostate gland increases with age, and as the gland grows, the stromal component increases. There are two parts in the prostate to discuss. One is glandular part, one is stromal part. Glandular part will secrete fluid, the prostatic secretions, which adds to the seminal fluid. But with age, the glandular part goes down, and the stromal fibrotic part, the cementing substance between the cells, it will go on increasing. Hence, the secretions of the prostate may be decreased, resulting in low volume ejaculate. So now let us talk about how to increase your semen volume. First and foremost thing is hydrate yourselves. So more water in the body, more water in the tissues, more water in the semen. The second thing is timing space between the ejaculates. So it is shown that if you wait for more than 48 hours, the volume of the ejaculate may increase, and it has gone up 12% per day until 5 days, after which there is no change in the volume. So abstinence period of around 2 to 5 days will help you show high volume ejaculate for your personal satisfaction and your partner satisfaction. But after 5 days, it has shown nothing. The third reason is extended foreplay. So if you are having proper stimulation for an adequate time, the prostatic secretions and the seminal fluid secretions will increase, though the sperm quantity and quality may be the same in your seminal volume, but it increases the ultimate seminal volume, resulting in satisfaction to you and your partner. And the last and foremost thing is quit smoking and alcohol, because these are vasoconstrictors. So they decrease the blood supply to these glands and decrease the seminal volume secretions. If you are having this regularly on a basis of at least 4 to 5 drinks per day for a week, or if you are having daily cigarettes for 4 to 5 per day, if it is a persistent damage happening, the seminal volume ejaculate will decrease because of decreased secretions from these glands. So these are the tips. If you have further doubts, please contact us at V9 Hospitals. Thank you so much.